On top of that industrial action, there's the high inflation, soaring channel crossings, a volatile NHS, cost of living crisis. The Prime Minister's got his hands full for 2023. So let's go through some of those challenges for you. And, of course, the strike action continues with the threat of at least the potential of a general strike this year. Rising number of illegal migrant crossings. 2022's Rwanda plan didn't take hold of the situation. How can Rishi Sunak tackle the problem now? There's talk about that number doubling to around 90,000 people crossing the channel in small boats this year. The war in Ukraine, of course. Well, Britain's pledged to continue backing Ukraine, but at what cost? Millions spent towards the war effort. Growing threat of an attack on Britain, so we're told, as a sort of key ally of Ukraine. Tough road ahead there. And the NHS on top of it all. Waiting lists, that record highs, industrial action as well. Could that institution crumble? Well, you've sort of got to hope not, haven't you? And then for all of us, the cost of living crisis, inflation driving up the costs of all the essentials, high interest rates, of course, affecting payments on our homes as well. And then there's energy prices that ties into all of that. The government support is going to waver, of course. The Prime Minister will need to find an alternative plan, will he, potentially, to ensure that we can all survive huge price increases post-April. Let's talk to our political correspondent, Tom Harwood, who's here. Tom, frankly, what an absolute blooming nightmare.
It's not the in tray that any Prime Minister would want. 2023 is going to be a really tough time. We saw just some of those challenges run through there. And, of course, there are many demands of government, not only for spending, but also on different wings. There's the regulatory reform that people want to see as well. And there isn't much time to do it in, of course. We've seen this session of Parliament extended now right through until later this year. We're probably not going to see another King's Speech until September, when we were expecting one. Well, we haven't had one this year at all, have we? And so we're really running through that old legislative agenda and still trying to get things through Parliament. Meanwhile, there seems to be crisis upon crisis that are building and demands for ever more money to be spent when there's ever little actually available to be spent.
I mean, this is the problem, isn't it? And, of course, with the strike action, never mind the NHS, that's almost a sort of separate issue, but with all the strikers across all the industries, the problem is they all want more money to be spent on higher wages. But that's then got the potential of wage inflation, which would then cause everyone problems.
What the government wants to avoid here is a wage price spiral. They say that double-digit increases across the board might sound good in the short term, but in the long term it embeds inflation in the system. The government say that inflation is predicted to fall sharply this year. That's something that they really hope they can stick to. It's one of the only things that really might well go well for them this year. But if we sort of embed those double-digit pay rises across the board, that could really push up the level of prices as well as a consequence, embedding that high inflation, keeping it in double digits for far longer. Now, it's a really tough message for the government to say, because no one wants to hear that the only way to get out of an inflationary spiral is to take a year of pain, is to take that hit. But that does seem to be the message that the government's putting across.
Meanwhile, the NHS is, as I was saying to Olivia last hour, is almost it's a separate entity in terms of the problems, aside from the striking nurses and ambulance staff and all the rest of it. There needs to be reform, doesn't there? Talking to a GP earlier on, saying, well, everyone tries to reform it, but I guess they tinker around the edges, don't they? Are we heading towards a point where actually there's going to have to be some root and branch reform?
Well, it's interesting. If we look at where the NHS was in terms of its funding back in 2010, £128.2 billion. That's the amount that year that was spent on the NHS. This year, it's £180.2 billion. A real terms 40% funding increase compared to just over a decade ago. Now, have services got 40% better? Do people feel like waiting times have gone down? No, they've gone the other way. Despite tens upon tens of billions of pounds put into the system, more money per person than ever before in the system. This is all adjusted for inflation, of course, as well. An extraordinary amount of money has gone into the NHS, particularly in the last 4 years. And yet the outcomes seem to be getting worse and worse. Now, it's fair to say that lots of health systems around the world are facing challenges. GPs are striking in France. The German healthcare system is creaking as well. In America, even, hospitals are full. There are clearly aftershocks of the pandemic here that are affecting all countries that were hit by COVID. But there is also something that seems a bit particular to Britain in the way that we are having these outcomes, perhaps in a more extreme way than other countries are having. And perhaps it's notable that the Prime Minister reportedly himself and his family choose to have private healthcare. And maybe you can start to see an argument whereby the government might want to recommend people that can afford it to take some pressure off the NHS by going private themselves.
Yeah, well, maybe that's going to be the way forward. Talking of healthcare, Tom, you should be in bed with a hot water bottle and a lemon sip, frankly. You're not very well at all.
It's true.
But thank you.